Keeping the patient pain-free during the vitrectomy surgery. It is 6th of February 2025. A good way for the vitrectomy surgery because we go inside the sclera in this surgery and it is quite a sharp trocar which go inside your eye at 3 points. So it would be wise to do in local anesthesia with a good retrobulbar block and to start an IV paracetamol during the surgery. That will keep the patient comfortable during the surgery. The second point would be to give atropine and midracil injection subconjunctivally if the patient does not have dilated pupil. Planning the surgery on a patient with floppy iris and small pupil, it is wise to stop the Flomax at least 5 to 6 days before the surgery. The key, very important point, when the biome is on, that is 3 mm from the cornea, how to keep the cornea hydrated, because whenever we spray water on the cornea, the lens on the biome near to the eye, which is only 3 mm away, gets drops of water and the surgeon's view is blocked. So this problem can be solved by keeping a cannula on the upper lid and give it a continuous flow with the help of a drip set. Another very good point can be in the vitrectomy we can make ports of 23 gauge and use the cutter of 23 or smaller gauges like 25 or 27 gauges. This might be a good case study for hybrid vitrectomy. In the vitrectomy, it is good to have a very close look at the IOP, what IOP is doing, because it should be not too low and too high because it will suddenly stop the retinal blood flow and can cause blindness. Good point in the vitrectomy of lens matter or nucleus removal is nucleus is usually adherent with the vitreous in the aura area. So what we have to detach it first from the vitreous. It will go on the retina, on the posterior pole, on the macula or near the disc, and we have to gently elevate it with the help of aspiration mode of the cutter only and decrease the cut rate and the vacuum when we are removing the pieces, and use the pipe eye or the light of the pipe as a second instrument to break it into pieces. After doing the core vitrectomy and shaving, triamcinolone removal or Kennicott removal is a key. So use the cutter in the aspiration mode and also use a flush technique with the help of flute needle. So the remaining crystals of Kennicott can be removed and it may not cause in the later time a raised IOP. We have to keep the air inside the eye, and the patient afterwards will complain that there is some level or a margin inside his eye. We have to counsel the patient that he will feel level or a margin in his eye for a few days. As the air gets leaky from the pores, the vision will start improving. In these 23 gauge vitrectomies as well, if we have a good trocar and the technique is good and we fill the eye with the help of the air, what we can do is we can fill the air in the vitreous cavity and it will opposes the wounds and we don't have to stitch the scleral wounds. Last but not the least point is doing the air fluid exchange, meaning by we have to remove the fluid inside the eye with the pressure of the air. So this would be our last step. We have to keep the air inside the eye, and the patient afterwards will complain that there is some level or a margin inside his eye. We have to counsel the patient that he will feel this level or a margin in his eye for a few days. As the air gets leaky from the pores, the vision will start improving.